Is Testogel absorbed straight away, or does it take longer than you'd think? It actually takes several hours for full absorption, and knowing that could make a real difference to how well your treatment works. If you're using Testogel, understanding how it's absorbed isn't just useful background knowledge, it directly affects whether you're getting the most from your treatment and whether you're keeping the people around you safe. So let's walk through what the evidence tells us. Testogel is a transdermal gel, which means it's designed to pass through the skin and into the bloodstream. When you apply it, the alcohol base evaporates fairly quickly, usually within 3 to 5 minutes tagged, so the gel dries fast. But that doesn't mean absorption is complete, far from it. Once the alcohol has evaporated, testosterone continues to move through the outer layers of the skin and deeper into the tissue beneath. Research indicates that roughly 9 to 14% of the applied dose is absorbed into the body over a full 24-hour period. The skin essentially acts as a reservoir, releasing testosterone gradually throughout the day to help maintain stable levels. After applying, make sure you wash your hands thoroughly with soap and water. This is an important step for reducing the risk of accidental transfer to others. This is also why the waiting time before bathing or swimming matters so much, and it varies depending on which formulation you're using. If you're using the 1% sachet gel, you need to wait at least 6 hours before bathing or swimming. If you're using the pump gel formulation, the waiting time is at least 2 hours. These aren't arbitrary guidelines. Washing the area too soon can reduce how much testosterone is actually absorbed, which may affect how well your treatment works. It's also worth knowing that application sites differ between formulations. The abdomen can be used with the 1% sachets, but should not be used with the pump gel. Always check your patient information leaflet for the specific instructions for your product. It's the most reliable guide for your particular formulation. In terms of when your levels settle, steady-state testosterone levels are typically reached within a few days of consistent daily application. That means applying it at the same time each day to the same recommended areas without missing doses. Blood monitoring is an essential part of treatment. Initial testing is generally recommended after 2 to 3 weeks, with ongoing reviews that typically include checks on hematocrit and PSA levels. Your doctor will advise you on the right schedule for your monitoring. One of the most important safety points with Testogel is preventing accidental transfer to others. Testosterone can be transferred through skin-to-skin contact, and this is particularly concerning for women and children. To reduce this risk, cover the application site with clothing once the gel has dried and wash the area thoroughly before any close physical contact. If you have any concerns about your levels or symptoms, speak to your doctor. They can review your blood results and adjust your treatment if needed. Never change your dose or application routine without medical guidance. Always follow your prescribed instructions. And of course, nothing in this video is a substitute for personal medical advice. Please speak to a healthcare professional about your individual circumstances. So to recap, Testogel starts absorbing within minutes, but full systemic absorption takes several hours. Wash your hands after applying, wait the right amount of time before bathing, 6 hours for the 1% sachets, 2 hours for the pump gel and cover the site with clothing to protect others from accidental transfer. Your patient information leaflet is your go-to guide for the details specific to your product. Have you got questions about Testogel or testosterone replacement therapy? Drop them in the comments below. We'd love to help. And if you found this useful, give it a like and subscribe to the Bolt Pharmacy channel for more straightforward health information.